Now to another medical topic, sometimes a sensitive one that's not always fun to talk about.
Yes, we have got a guest today. This is Nurse Dani from Intermountain Moms. How common is infertility in couples?
Yeah, it's a lot more common than people might think, and I think it's important for people to understand that, because then if you go through it, you know that there's other people who face it too. About 15% of couples go through it.
15%?
Yeah,
wow.
So line up all your friends. Chances are at least, 1 out of every 10 has
Is it a
faced
growing number?
That's a good question. I don't know that for sure, but I think thanks to modern technology, more couples who have infertility issues are actually able to have a baby of their own.
So after you go talk to a doctor, what are some of the new ideas and procedures that you can have done to make sure that you have the happy family you always want?
That largely depends on the reason behind the problem in the first place. A lot of women, in about half of instances where there's infertility, it has something to do with the woman's reproductive tract. So clogged fallopian tubes, or she's not ovulating or something. So if she's not ovulating, you can take a pill to stimulate that, or there's a procedure to flush out the fallopian tubes. Actually, it's important for women too, because I think they feel a lot of guilt when there's infertility, to understand that 35% of the time it has to do with the male. So like a low sperm count or something, and there's procedures that can be done to help that too.
Okay, on the female side, you said about the fallopian tubes, and that sounds like an invasive process to find out. How can someone find out what it might be that's getting in the way? On the male side, we know. On the female side, I mean, it's obvious, right? On the female side, though, maybe a little more complicated, at least sounds that way.
Yeah, if I understand it correctly, they inject dye up to see if the fallopian tubes are blocked or not. And if they can't see the dye go all the way through, then they can flush it. And it involves a little bit of pain, but you recover in a day or two and hopefully get pregnant after. A lot of women do. And that's a pretty simple thing. Like, it's an easier step before IVF, in vitro fertilization, those sorts of things.
Okay.
Because you get down the road, it gets more and more expensive what you try.
And I think it's costly either way, financially as well as emotionally. Whether you face infertility and that fixes it, or you have to do IVF, it's hard to go through. It is an emotional roller coaster for couples.
And you said 35% of the time it's the male too.
Yeah.
So really it's not about just getting the female checked over and over for different things. The male should get checked too.
Boys have to go to the doctor too.
Yeah, they should. And if you go, it's really important to remember, if you've been trying for a year and you haven't had success, that's when it's time to go.
Okay.
They do a test, they check your blood, they ask you simple questions like, maybe you cycle too much and so you have a low sperm count. And if you stop cycling, you'll have a baby, and that doesn't involve any other additional cost.
Okay.
Perfect.
Good information from Nurse Dani. Thank you so much.
You're welcome.
Thanks for having questions online too. She's full of knowledge.
Good, because I have many.
Okay, good. We're going to have to ask those now on TV though. Right now though, we do need to talk about